Hi there, so you've finished learning the second section of First Aid 5, strokes and seizures. I'm here to remind you about the key things that you have learned. Introduction to strokes. So we started by learning what a stroke is. We learnt that the best way to think about a stroke is that they are a brain attack. A stroke is also known as a CVE, or cerebral vascular event. When a stroke happens, the blood supply to the brain is cut off and brain cells are quickly damaged and start to die. We learned that there are two main types of stroke. Ischemic stroke. This is the most common type of stroke, and it's where there is a blockage in the artery to the brain. Hemorrhagic stroke. This is where a blood vessel bursts and bleeds into the brain. Mini strokes. We learnt that a mini stroke, also known as a TIA, or transient ischemic attack, is often a warning of a full stroke. FAST test. We learnt that the FAST test is used to help diagnose a stroke. Has the face drooped? Can the arms be raised up normally? Is the person's speech normal? If any of the above are not normal, then it's time to call for an ambulance. We learn other symptoms include, but are not limited to, weakness on one side of the body, confusion, severe headache, vomiting, and affected vision. These symptoms are often the same for a mini stroke or TIA, but the symptoms would normally fade in less than 24 hours. Seizures. We learned that seizures are also brain-related, and they're caused by a temporary disturbance of electrical activity in the brain. A seizure is often referred to as a fit. Epilepsy is defined as a tendency to have seizures, so having one seizure doesn't mean someone has epilepsy, but having recurrent seizures may mean a diagnosis of epilepsy. Causes of a seizure. If the patient is not a known epileptic, then the seizure may be caused by a blow to the head, lack of oxygen, low blood sugar, drug or alcohol withdrawal, or a high fever, particularly in children. Stages of a seizure. We learnt the 4 stages of a seizure are aura, a strange taste or feeling; tonic, the muscles stiffen and the patient collapses; clonic, the muscles relax and tighten, causing the body to shake and jerk; postictal, the recovery phase. We learnt to keep the patient safe during a seizure by removing dangerous objects from near them and to cushion their heads. We should call an ambulance if it's the patient's first seizure, if the active part, the tonic and clonic stages, lasts longer than 5 minutes, or if the patient has 2 consecutive seizures without regaining consciousness from the first. Febrile convulsions. We've learnt that febrile convulsions are usually harmless and occur in young children, normally between 6 months and 3 years old. This happens when they have a high temperature and can't regulate it. We should keep them safe just as you would with an adult seizure, while also cooling them by removing outer clothing and opening a window. We should call an ambulance if this is the child's first fit, if it lasts longer than 5 minutes, if they have breathing difficulties, or if we are concerned in any way whatsoever. Summary. So we have learnt all about strokes and seizures, and that they are related to the brain. We learnt how to look after a patient and when to call an ambulance. Having now learned our First Aid 5, we will understand a lot more about what's happening. And should there be a need to call for an ambulance, the call handler will also guide you through what to do until the ambulance arrives.